Thank you. I would like us all to imagine standing at a pharmacy counter, holding a prescription from your doctor, and wondering whether or not you'll be able to fill it. Having to do a mental calculation about whether you'll be able to both get the antibiotics to treat your pneumonia and have enough money to feed yourself in the same day. Imagine being a worker, contemplating having to go to work in unsafe conditions, but knowing that if you don't, your family member will lose access to the essential medications they need for their chronic illness. These are the impossible choices millions of people are facing across Ontario today in the absence of a universal Pharmacare program. Currently, 1 in 5 working Ontarians do not have access to any prescription medication coverage. Lack of prescription medication access is also disproportionately higher among immigrant and racialized workers and young entry-level workers who are more likely to work part-time or have precarious employment. As a result, we see many people in our communities who are not receiving the appropriate treatment for the known medical conditions that they have, leading to preventable complications or even death. And I saw this in my own family practice. People who would be ashamed to say that the reason their blood glucose was far higher than it should be for their diabetes was because they weren't able to afford their prescription medication that month. And I remember trying to scramble around the clinic to find drug samples or apply for compassionate coverage, knowing that even those stopgap solutions would fall through in just a short time. Medications are one of the essential tools that we have in healthcare to prevent and treat disease. And just like other forms of healthcare in our province, access should not be restricted only to those who can afford it, but should be available to all who need it. And so I stand before you today to urge the government to take meaningful action on this issue by expanding access to prescription medications and ensuring that all Ontarians, regardless of age or income status, have access to medications under the Ontario Drug Benefit. Because access to life-saving prescription medications should not depend on your age, your income, or your employment status. Canada is the only high-income country with universal health care that does not have a requisite, fully funded Pharmacare program, the only one. We pay for doctor's visits, emergency department visits, hospital stays, MRIs, blood work, other tests, but not for the medication your healthcare provider has prescribed to you in order to stay well. It's a gap that not only doesn't make sense, but it negatively impacts the health and well-being of people across Ontario every single day. Right now, Ontario ranks among the top 3 provinces with the highest prescription medication deductibles in Canada. Through the Trillium Drug Benefit, Ontarians must spend 4% of their household income on prescription medication before any access to coverage might begin. And at a time when rents are skyrocketing, food prices have gone up tremendously, and the cost of living is becoming less and less affordable, this threshold for medication coverage is far too high for too many Ontarians. This financial burden forces many individuals, especially those living with chronic conditions, to navigate complex systems, fight for approvals, and in some cases, forego their prescription medication altogether. Currently, Ontario's drug benefit is available to people under the age of 25, over the age of 65, and to those on social assistance or in long-term care. And for those who have access, it's a fantastic resource that allows them to continue the treatments for their diseases without having to choose between their medications and putting food on the table. But there are far too many people across Ontario who have been left behind with our current Ontario drug benefit. For anyone between 25 and 65 who is working, but perhaps is self-employed or doesn't have access to private benefits, they are forced to make impossible choices. We know that for many, this choice ends up being to ration or skip doses of their medication because their budget just simply won't allow them to take it every single day. For others, they may never be able to fill their prescription and access the medicines that they need. Right now, people in Ontario are choosing between groceries and their medication. Workers are having to decide between continuing to work in unsafe working conditions or risk losing their benefits and their families' access to prescription medication. We can do so much better for the people of Ontario. We talk a lot in this House about only paying for healthcare with your OHIP card, never your credit card. But somehow we lose that principle between the time it takes for someone to walk from their doctor's office to the pharmacy to fill their prescription. And every year, Ontarians are spending millions of dollars out of their own pockets on prescription medication because they lack public or private drug coverage. That's money that isn't going to rent, it's not going to groceries or other essentials, but it's going to something that we should be providing for them. By expanding Ontario drug benefit eligibility to include all Ontarians, we could immediately put that money back in people's pockets while taking better care of their health at a time when they desperately need us to have their backs. We also know that when people are healthy, they are better able to participate in our workforce, our economy, and our communities. At a time of economic uncertainty, expanding access to the Ontario drug benefit is one way our government could immediately act to support Ontarians and increase the resilience of our economy and our province in the face of tariffs and trade threats. Right now, workers across Ontario are afraid of losing their jobs. And while they're afraid of losing their jobs, they're also having to worry about the health benefits that themselves and their families depend on. If we pass this motion and expand access to the Ontario drug benefit, all people in Ontario would know that we have their backs in ensuring that they won't lose access to their medication no matter what happens. We also know that universal Pharmacare also eases the burden on employers, many of whom are struggling to provide comprehensive drug prices to their employees under the harsh prices of private drug companies. Because private drug companies are so expensive, employers are having to eat into their profit margins, which is something that is particularly negatively impacting small businesses who want to provide for their employees. If the province were to take on responsibility for medication coverage for all Ontarians, employers could redirect those essential resources to focusing on growing their businesses and fortifying their businesses against a potential recession that we now face. When we talk about a tariff response that puts Ontarians first, ensuring that every person in Ontario has access to their essential medications has to be part of that plan. Implementing universal public drug coverage that is both comprehensive and evidence-based would be the best way to ensure the accessibility and affordability of medication in Ontario. The expansion of Pharmacare would lower costs for all Ontarians, as medications could be negotiated through bulk purchases, and the ability to bulk purchase medication for a public Pharmacare program would significantly reduce the overall medication cost that Ontario pays today. In addition to these cost benefits, expanding prescription medication coverage actually reduces overall health system costs, offsetting overall program costs of a Pharmacare program. Estimates have shown that even by expanding prescription medication costs just by an essential medicines list in Ontario, it would cost us an additional $1.3 billion, but we would save $2.1 billion on overall health system costs. Very few other interventions that we could offer actually reduce healthcare costs while so effectively increasing access to an essential service. And if we choose not to pay for medications at the pharmacy, we're going to pay for it in our emergency departments and in our hospitals. Because when we miss opportunities to treat illness early with the right prescription medications, we end up seeing higher rates of hospitalizations, surgeries, and other complications that could have been avoided. We can't afford to let our health system be further strained, and we can't afford to let Ontarians become ill and suffer when we could have prevented it by providing access to the medications that they need. In a randomized controlled trial by Ontario researchers, 786 people across Ontario who could not afford their medications were given free access to their medications for 3 years. And over those 3 years, the research showed that per person, our total health care costs were reduced by $1,600. Imagine that we could save money not with budget cuts or with reducing services, by actually expanding services and allowing access to essential medications that people need. And beyond the healthcare cost savings, we also know that by moving to a publicly delivered Pharmacare program, we would save money that is currently being funneled into private insurance companies. As one example, 10% of the workforce in Ontario, about 650,000 people, are Ontario public sector employees. All of those employees have access to a medication coverage through private benefits paid for by the Government of Ontario. And those benefits are delivered through private insurance companies. But we know that private insurance companies are the most expensive way to offer medication coverage, far more expensive than publicly delivered Pharmacare programs. So as it stands now, we are actively diverting public money into the private sector to pay for medications for our public workers instead of taking care of Ontario employees ourselves by offering them access to the Ontario drug benefit. We should not be paying private corporations a premium to do our job. We are responsible for delivering healthcare in this province, and we can do that by expanding Pharmacare today. And expanding prescription medication coverage is not a radical thought. Like I said, Canada is the only high-income country with universal healthcare that does not have a universal Pharmacare system. And overwhelmingly, Canadians support Pharmacare. When we poll them, when we ask them, 86% of Canadians have affirmed that access to publicly funded prescription medication should be expanded. On how many other issues do we have that kind of wide-sweeping support in this province? This could be a tremendous win for Ontario at a time when people are desperately looking to their government for leadership. And until now, we have not been a leader in healthcare. We have the lowest per capita spending on healthcare of any province in Ontario, but we could be a leader here. In doing so, we could show up for Ontarians at a time when they desperately need us to show up. And so I ask the government to stand with me today and expand coverage for prescription medication to all Ontarians, ensuring that everyone has access to the treatments that they need at the time that they need them. Thank you.